And on behalf of the PA program faculty and staff and Dr. Ely, I would like to welcome you to the white coat ceremony for the Emory PA class of 2022. Give yourselves a hand, people. Class of 2022. It's been quite a ride so far, hasn't it? As you move through your second year of PA training, because we are there, good things await. Clinical rotations are right around the corner. That's where you turn your focus to real people, real problems, real patients every day, with an eye toward building on the foundations you've laid in your first year. You've spent the last year learning the basics of your profession: history taking, physical examination, anatomy, biochemistry, microbiology, immunology, pharmacology, pathophysiology, and ethics. And the modules. Just think about how far you've come. I'm going to name them all. Just hear these, okay? And think about what you've learned. Psychiatry, dermatology, hematology, oncology, pulmonary, head, ear, eye, nose, and throat, cardiology, nephrology, urology, neurology, orthopedics, rheumatology, obstetrics, gynecology, geriatrics, emergency medicine, and surgery, with pediatrics and infectious disease refresher on the horizon. You've worked very, very hard during a period of time that's tremendously challenging, demanding, full of new expectations, experiences, challenges, and transition. Not to mention COVID, with all of its uncertainty, fear, loss, and change. Sit back and think a minute. You really have come a very long way. Whether you realize it or not, you're fundamentally different today than you were one short year and change ago in terms of your knowledge and your skill set. You have begun your professional journey. You have traveled no small distance, and I dare say that for most, if not all of you, there's no period in your previous experience during which you've learned more academically in such a short period of time. So congratulations on your progress. And yes, exams are always around the corner and on your minds, but these too shall pass with hard work and your best efforts. Then very soon rotations, they begin, and the learning takes on a whole new level. A new specialty every month, starting over, the learning curve steeper than ever, but more exciting than ever because of the realities of clinical medicine. This is the good stuff, people. So this time, in some ways, represents the crossing of among the first of many thresholds on the road to becoming a medical professional. And so today, we acknowledge and congratulate you on your substantial progress to date, progress that is undeniably disproportionate to the relatively short period of time that you've been here. Now, while we look back, maybe pat ourselves on the back a little bit, we also look forward to the miles before you with this white coat ceremony. And so with that, our physician assistant program director, Dr. Maha Lund, is always eager to speak with you as we mark this occasion. Please welcome Dr. Lund.
Dear PA class of 2020, family, friends, faculty, and other distinguished guests, it is so good to see you all here. I'm so glad we're able to gather together. I am so proud of you, of what you have accomplished, each one of you. And I'm pleased to share with you today a few words about the significance of the white coat. We were just joking that in many clinical settings, we do not necessarily wear the white coat anymore because of infections and so on. However, there is symbolic meaning here, and that's what I want to talk to you about. So the white coat was introduced into medical practice at the beginning of aseptic surgery in the late 1880s. The first white coats were actually beige and were in contrast to the black jackets that administrators wore. They were short-sleeved and they were open in the back, which really made no sense for the clinical setting because I don't know how they tied those lab coats. But during this time, clinicians started using science as the basis for medical decisions, and medical doctors soon adopted the white coat to represent themselves as scientists. The white coat has become a symbol of life, purity, and innocence. It stands for goodness, hope, and compassion, as well as professionalism. It is seen as a symbol of the clinician's commitment to do no harm and is a cloak of compassion. It is a measure of competence and credibility. White coats remind us of our professional duties and that we should lead our lives and practice our art with uprightness and honor, as Hippocrates said. White coat ceremonies are actually a modern tradition. They were first introduced at Columbia College of Physicians and Surgeons in 1993, so they're not that old. Since that time, these ceremonies have welcomed students of medicine into the profession and have reminded them of the ideals of honor and compassion. Power that comes with medical knowledge must be respected and never taken for granted. Today, we celebrate you and welcome you into the PA profession by placing white coats onto your shoulders. These coats are short, identifying you as students of medicine. And when you graduate, you will wear the longer coat, indicating increased knowledge and skills. Remember that medicine is ever-changing and requires lifelong learning. Donning your white coat today represents an important step on your journey to becoming competent and compassionate physician assistants. In a few minutes, you will take the physician assistant oath. It emphasizes that you will adhere to the core values of honesty, integrity, altruism, and empathy. It will remind you to always put the health, safety, and privacy of your patients first. You will pledge to be professional at all times. Becoming a professional happens in and out of the classroom. It is a learning and socialization process that is shared between the faculty and the students. Much of professionalism is learned outside the formal curriculum in interactions with other professionals, the faculty, and especially with your patients. So what does it mean to be a professional? When I started my very first job as a hospitalist PA at St. Elizabeth's Medical Center in Brighton, Massachusetts, my learning curve was very steep. I was scared every time that my pager went off. And yes, I'm aging myself or timing myself here because I had a pager. But I was scared because I wasn't sure that I could handle everything that would come my way, that I could answer every question that could come my way. But after a few months, Dr. Neuschatz, my attending, he pulled me aside and he told me that he had watched me, how I cared for my patients. And he told me that he would be comfortable having me take care of his own grandmother. And I have to say that that was the greatest compliment that I ever received as a PA. And I encourage you to be the kind of professional that people will trust with their loved ones. Now, that doesn't mean I will always be a perfect PA or program director or mother, as our teenage daughter or our daughters like to remind me when they were teenagers. They luckily outgrew that stage, so luckily for me. So your faculty or classmates or even preceptors may sometimes disappoint you. Some of your patients might not listen to your advice. And at times, members on your clinical team might not act ethically. And you knew I had to put ethics in here, right? However, it is up to us to decide how we will respond and how we will move forward in situations like that. But the white coat alone does not make the wearer knowledgeable, respectful, trustworthy, and caring. It is up to you to embrace and develop these traits, whether you're wearing the coat or not. Your white coat should be worn proudly as a symbol of service, compassion, and humility, and not one of arrogance or privilege. Today, as you accept the white coat as a symbol of your entrance into the PA profession, you take on responsibilities to embody these qualities of professionalism. Oh, if you could only see the vision that I have for each one of you. As Bill said, the remaining 14 months will go by quickly. They will be intense, and much will be required of you. But I can also promise you that they will be very rewarding. Please take advantage of your faculty, of the support services here at Emory, and please rely on and work with your classmates. So at the end, I would like to congratulate the members of the Emory Physician Assistant class of 2022. I look forward to watch you grow and become the best physician assistants that you can be for the good of your future patients. Thank you.
I don't think that Dr. William Ely would mind me saying that he's a Georgia boy who's Emory through and through. He is a Georgia native. He can't seem to get enough of Emory University. He earned a Bachelor of Science degree in chemistry, undergrad, at Emory. Then he earned his medical doctorate at Emory. Then he earned a Master's of Public Health, you guessed it, at Emory. After completing his training in hematology-oncology, he joined the Department of Epidemiology at the Rollins School of Public Health in 1989, taught and pursued his research interests, investigating disparities in survival among African American and Caucasian women diagnosed with breast cancer. He's worked in clinical oncology at Grady, Crawford Long, now Emory Midtown, and now the Winship Cancer Center and Emory University Hospital. He's been teaching epidemiology for years, dare I say decades. He has been director of admissions, served on numerous committees, institutional, state, national. He currently serves as Executive Associate Dean for Medical Education and Student Affairs at Emory School of Medicine, all the while continuing to care for patients. And perhaps equally, or more important than that, he's just a good guy. He's the kind of guy that'll stop on a Saturday morning and chat with you while you're cutting the grass. Please welcome Dr. Bill Ely.
If only my mother were still living. And Bill and I have stopped and talked while he was cutting the grass. And I didn't know where he lived, so I took advantage of a great moment on a long walk to have a great conversation with a wonderful human being. Thank you, Bill. Thank you, Dr. Lund. And thanks to all the faculty, my great colleagues who sit on this stage and are on the front row as well. Thank you all for being here. Thanks to our families and friends and loved ones for being here. That makes this a very special day that you are here with us. And it's not just White Coat Day. It's Eugene Stead's birthday. And that is why PA Week is in this time of October. And you're getting your white coats on the day that the man who founded the PA programs was born. So what a day. And to top it all off, it's the 50th anniversary of our PA program today. Can I get a round of applause for 50 years? So I'm going to do a little bit of history of the PA program because it is right that we do so. And I want to start by showing one slide. And I don't think y'all are going to have to get up, and I hope, there we go. So take a look at that slide. That is the Department of Internal Medicine at Grady Hospital, Emory University in 1942 and 43, during World War II, another stressful time. The man with the white buck shoes in the middle there that stand out because the two people inside of him are wearing black shoes is Eugene Stead. Eugene Stead was born in Atlanta. He lived in Decatur, and then he got a scholarship to go to Emory University and went there and then got enough money to continue in it. He started the university when he was 16. He graduated when he was 19. He graduated from college at 19, graduated from medical school 3 years thereafter, and then went to Boston to a little hospital called the Peter Bent Brigham, which actually was an inferior hospital then in Boston. It was not the Mass General. But he went there, little guy from Georgia, great man from Georgia. Then went to Boston City Hospital, went to Cincinnati General Hospital, and did residencies then. He started out as a surgical resident and quickly found out that he did not have the gifts to be a surgeon, and instead studied internal medicine. And in 1942, came to Emory and became the chair of the Department of Internal Medicine at Emory. He stayed as chair until 1945 when he accepted the deanship. And this story goes that after about 6 months of being dean, he resigned in disgust. And he wasn't disgusted at really the school. He was disgusted that he couldn't teach anymore and he couldn't take care of patients anymore. And that's what he thought he was meant to do in his life. So he took the man to your right, to his right up here, John Hickam, with him to Duke. John Hickam later became the chair of medicine at Indiana and took it to a top 10 department in his lifetime, which was ended, unfortunately, from cardiac disease at age 54. And if you haven't heard of Hickam's dictum, it's not really, I can't repeat it in mixed company, but you will learn it at some point. It's an apposition to Osler's dictum. But John Hickam was a great person of medicine. And to his left is Paul Beeson, a giant of medicine, who became chair of the department once Stead left Emory in 1952 to be chair of the department at Yale, left Yale to become chair of the Oxford College, England, Department of Medicine, and was knighted and was Sir Paul Beeson, before he returned in 1974 to the University of Washington to really start the first program in geriatrics in the United States of America. Dr. Stead had a textbook of medicine. Dr. Beeson had a textbook of medicine. And I'm sure Dr. Hickam would have had he lived long enough to produce it. That was the Department of Medicine at Emory University, you all, in 1942 or 43. And those were just the leaders. So I just want to tell you, you come from a great lineage. I want you to accept that. We all come from that great lineage of leaders. And every one of those people, to a person, was known for their care of their patients. Paul Beeson, perhaps the greatest caregiver of any person of his time. So that's our lineage. That is the lineage of the PA program standing there in the middle. Who did that at Duke? He would have done it here had he been here. Who recognized, and I hope you all know this, he was so forward thinking that Eugene Stead thought, there is no way we're going to be able to take care of patients with all of we're learning with just a doctor and a nurse. And that was sort of the model, outpatient or inpatient, a doctor and a nurse. And Eugene said he actually tried to start the first nurse practitioners program, but he failed at that because the nurses would not approve the program he had come up with. So then he saw these core persons coming back from the war in Korea who had had all kind of experience in really tragic times on the front lines. And he said, given what they already know, they can help medicine. And just to let you know, that's where your 2,000 hours of service before you came to this program, that's where that started. People don't become PAs who don't have experience. You must have experience so your training can be shortened and you can get right to work, which is in how many months? 14? That's a very short amount of time. Not that I'm trying to make you nervous. I'll talk about that more in a minute. By the way, Dr. Stead, when he was in Emory Medical School, just to let you know how far we've come, the year before he graduated, we were on probation. And fortunately, we got off probation and were accredited the year he graduated from medical school. We were one of the medical schools in 1912 that Flexner had said should be abolished. And it wasn't until the MD program was merged with Emory University that Emory School of Medicine actually gained credence as a medical school. The merger of science, as has been alluded to, and human care, the care of humans. I'd like to say that these two wonderful people have covered almost all my talk, so it's going to be only a couple of minutes. I'll do a little bit more than that. But what Bill and Maha just told you are words to remember the rest of your life. I'm going to also talk to the people who came here to be with you today a little bit about you because they're important. Just to let you know the story at Emory for the PA program, and this is our last history lesson. Dr. Willis Hurst, who was also a great person of medicine, was the chairman of the Department of Medicine after Dr. Stead, Dr. Beeson, and one more person, then Dr. Hurst in 1957. Dr. Hurst also saw people that he was working with in cardiology who were absolutely brilliant. And I will let you know this, if you don't know this already, most of you do know this. When you're working in healthcare, the degree does not mean anything about who's going to be the best person at just the right time to take care of a patient. And in fact, we do have to work in teams. It's essential. And you will be that person. It won't be 14 months from now, but it may be 5 years from now when you've had enough experience in what you're doing. You will be that person in the room that makes all the difference for the people we care for. So it's coming. It takes experience. It takes seeing a lot of patients. Dr. Stead would tell us the only way to really learn medicine is to see a lot of patients. So get ready. Hang on to that. I was lucky enough to work with Dr. Hurst as my chair of medicine. I can tell you he was an amazing person. As a teacher, he never told me once during my 3 years of internal medicine residency that I actually got something exactly right. Dr. Hurst was this big man and he had a huge hand. And I remember working on the electrocardiogram, which he was the world's expert in. And I'd be diligently plotting all of the vectors of the heart. And I'd feel this big hand go whoosh on my back. And I was like, oh no, what am I doing wrong? And Dr. Hurst would say, Bill, you need to move that one up just a couple of degrees. He said, but you're doing it, son. You're doing it. Keep it up. I tell you this because we're talking about a threshold today, and this is a big threshold. It's a symbolic threshold, but you're lifelong learners, and you will continue to get smarter and better caregivers the rest of your lives. All right, now for the main event. What is up with these white coats? You've heard a little bit about this, but why did we ask your family and friends and loved ones to come as you don a pretty cheap polyester cotton blend? Why are we here? And I'll borrow a little tidbit from my friend, Dr. Ira Schwartz. Other people wear white coats. Butchers wear white coats. Chefs wear white coats. but they don't have white coat ceremonies. In fact, Arctic bears wear white coats. I'm pretty sure they don't have a ceremony. But I will say both the butchers and the chefs, part of the role of their white coat is to show us that they are clean. But the other part, if you think about this, is to protect them from all the splashes, all the things that are not nearly as dangerous as the things that will splash you and come your way. But I also want for you to think of that white coat a little bit as your protection. And I want you to think of that theoretically. There's no Kevlar in that coat, but there are allegiances that we form with other people who wear white coats, whether they're doctors, nurses, PAs, PTs, go around the list, that will protect us. As it's already been told, the only thing I'll add to the history of the white coat is that actually nurses and doctors wore dark clothes, the dark and even black clothes for men, the nicest suit they could afford, which was not always very much. And the nurses' garb came from the nuns' garb because, and they were still in England, nurses are called sisters because most of the first nurses were Catholic nuns in Europe and they wore their black garb. But as has already been said, as science came along, white became the signature of medical care. It was the merging of science that led to the white coat. And by the way, the movement toward sanitary conditions. If you haven't heard this, Ignaz Semmelweis, who was a physician who advocated for people washing their hands between delivering births and going to the pathology lab, was harangued both verbally and physically. He was beaten and ended up in a mental institution because people thought he was a curse on medicine, because he asked people to wash their hands and was trying to prevent puerperal sepsis. That's how bad it was. 30 years later, we'd had Lister and Koch and Pasteur, and we knew there were bacteria, and all of a sudden Semmelweis was a hero because he had urged us to do things that we should have been doing. That was part of the white coat, to be clean. I'd like to say, as society, we are now more than ever benefiting from the merger of science and the care of people who are ill. We are only able to gather today because of the miracle of the COVID-19 vaccine. We would still be virtual if not for that vaccine. And I've told people that I love who've asked me for advice, I think it's one of the safest, most effective treatments modern medicine has ever produced. So I just want us to be grateful of that part of the white coat, that science that is helping us through this terrible illness that, again, Bill and Maha have also referred to. Truly a miracle. All right, becoming a physician assistant, like anybody who agrees to put on a white coat and go in a room, requires a transformation. You heard Dr. Lund talk about that. You've changed. You're about to go through even bigger changes, although I know because you've worked with these people, your faculty and staff, you have already been changed. But you're about to go through a major transformation, and I liken it to a couple of sentences. Before you go to medicine, as altruistic as you are, and you are incredibly altruistic, I know that about you. You all are the folks who take care of our farm workers. You come here because you take care of farm workers in the boiling heat of South Georgia, which is where my family's from. It's a lot of hard work. But you go from the first concern being about you, which is absolutely normal for a human being, right? I have to be safe. A 2-year-old will really show you what it means to be me, me, me. We gradually get better at considering others. But becoming a PA, you're going to transform to someone who even thinks more highly about the health of those you serve than yourself. And other people do that. But people in healthcare, and boy, do we know about that over the last year and a half now as we fought COVID. We have really stepped up. You have stepped up. People are coming to school to be in healthcare more than ever. They are not running away from this epidemic. They're running toward the people who are suffering to help. So that's the transformation I hope you know you're going to go through. It's a wonderful thing to do. We invited families and loved ones here for the symbolic donning of your white coats. And I want to take a few minutes just to reflect on my own path in the white coat. And I had a flash when I came in here. This building was just built when I started medical school in 1979. I got my white coat in here. Back then, we didn't have white coat ceremonies. It was during orientation in medical school, and I got a white coat. That was it. I took it home. I got a picture taken with my roommate, Wesley Eastridge, who's now in family medicine in East Tennessee. And we both had our white coats on, and we were kind of preening. You know, we were preening for the camera. We thought we looked cool. And I vividly remember I felt scared. You know, it's like, oh, what does this mean? The weight of that started then. And to tell you the truth, I had no idea how big that weight would be. I sometimes tell people, if we did know how big the weight would be, we'd all run from the building right now. You'll get progressively more comfortable with the weight. You'll get progressively better at helping others the rest of your life. We've already talked about the white coat can be a double-edged sword. You all have already used the words to describe it. Science, trust, cleanliness, protection, purity of intent. It can also be associated with aloofness, superiority, authoritarianism. And it actually, while it can be a barrier to protect us from all the things I got in when I was, before we wore gloves, when we drew blood and did all the things we did as trainees, it can also be a barrier to feelings for your patient and for you. I think sometimes we put on this white coat, we think we're super people. As it turns out, we're not. We are people. We will have fears. We will have trials and tribulations from having that white coat on. And I'll just tell you, the worst thing you can do is lock those up inside that white coat. We need to talk with each other. We need to talk about the care we give. We need to talk about the hard times, and there will be hard times with each other, with the teams we work on. It's really important. And we have family members in the room. You all probably heard them saying words that you never thought your child would say, and you don't understand them. And you never will. However, the people who are sitting here are critical to your success as a human being. And that's the reason they're here today. In my medical school days, except for psychiatry and pediatrics, my white coat was a utilitarian masterpiece. I carried more stuff in my white coat than you could fit in your pickup truck. I mean, and when you spend all night in the hospital and you're running from patient to patient, it's just amazing what you can carry. Stethoscope, reflex hammers, tuning fork, eye chart, IV equipment for several IVs of several different kinds of people. Because some people the only thing you could get in was a butterfly. The nurses would hate you for that, but that's all you could do. But I had all different gauges, all different straight IVs, all different butterflies, all the tubing that I needed, because when you got called for an IV, you just had to go in there and get the IV in. So tourniquets, Band-Aids, syringes, lab tubes, tape, dressing, everything that you needed to put in IVs plus. Back in my day, we took Hemocult developer and Hemocult cards everywhere we worked. Those were old cards. You may not have used them to test the stool for blood. In the old days, we tested everybody's stool for blood, every person that came in the hospital. And if you didn't have your Hemocult card developer, it could be a real goat rodeo to try to find one. So when I finished my history and physical, I could do that hemocall. It was in my pocket. I knew exactly where it was. I had an ophthalmoscope, an otoscope. I will tell you, of the 1,000 physical exams I did during my internship, I tried to look in every person's eyes. I don't know if we'll do that anymore now that cameras have taken over, but I tell you, I think I saved a couple of people's lives by finding things that I would have never found had I not done those first 1,000. Whatever you do it repetitively and have good habits. I had Q-tips. I had pens for measuring sharp and dull. Everything in that coat that I could possibly carry. And by the way, my first beeper, it didn't even have numbers on it. People talked through it. Never forget Joe Hardison at the VA. He was a yodeler and he would yodel. Morning report, morning report. Absolutely hilarious. 7 o'clock in the morning. That's why we woke up for medicine rounds. It was wonderful. Great man of medicine. On my psychiatry rotations, most of the attendings didn't wear white coats. I found that interesting. They spoke of the potential barrier that it put up with our patients. I also noted that my pediatrics professors often wore pastel smocks or no coats at all. And I'm telling you, they had the most fun of anybody in medicine that I saw. They loved playing with kids. A physical exam with a 3-year-old was about playing with a child. And that had an impression on me. As I became an oncology fellow and then an attending, I quit having to carry all that stuff because most of my work was turned out to be outpatient, where we have ophthalmoscopes and everything right there we need. And so I gradually kind of walked away from my white coat. I'll tell you also, I'm a hot-blooded person. I think I've got Norwegian in me somewhere, and having to wear an extra layer of clothing in the summer just did not fit my disposition. So, but I'll tell you what I didn't give up. 2 things I didn't give up. I've always worn a tie and a dress shirt and dress pants and shoes. One of my mentors, Ken Walker, said, whatever you wear into the hospital, the patient should be able to know that you are different than the painter. I found that good guidance. We should dress professionally. And the white coat's part of that. The other thing I never forgot was that the white coat has meaning. And it has deep meaning that we've talked about in caring for others. So I'm not against white coats, but the only thing worse than white coat hypertension is oncologist hypertension, which is what I give. So I figure I'll give my patients a break and not put their blood pressure up just a little bit higher. All right, I'm going to talk about something. I want to emphasize the fear and trepidation that accompanies becoming a PA or any healthcare provider. The absolute weight of responsibility that any good-hearted person, and you are good-hearted people, that you feel when you agree to put on this white coat and go into rooms and try to help people who are suffering. It is a big deal. It goes without saying that entering healthcare during the era of COVID adds to our own fears and increases the suffering we encounter and increases the fear of those we care for. The good news with all this fear and trepidation is these folks sitting up on the podium and in the front row and out behind you. These are folks who will walk with you as you go through this transformation and support you at every step of the way. We all need support. My sincere hope for you, and we've mentioned this, but you all are so close, this is great, is that when you start seeing those patients every day, it's going to be great joy. I've never learned as much as when I started seeing patients. I've never learned things that I've remembered as much as when it's been associated with caring for a patient. And I have never found more joy than the kindness of patients toward me when they feel like they've been cared for. It is a gift like no other, and it is encapsulated in this white coat that you're going to put on today. With support of all these folks here, you all are going to become humane and exceptionally competent physician assistants. I want you to remember that. as you start off. And finally, what can our fellow students, loved ones, and teachers do to nurture us through this process? So this process is part of that. Today, we are coming forward together intentionally with loved ones and others to pause and reflect. It's a big deal, what you are doing. The best caregivers take time to pause and reflect. I ask the loved ones here to help us by reminding us that slowing down and reflection are a necessity and healthy part of being a humane caregiver. We have very intentionally involved you families. Let us be ever cognizant of the essential roles of our families, loved ones, friends, and faculty. The relationships represented here are vital to the support of all humans, but especially critical for caregivers. Family and friends, your ongoing care and understanding is the greatest gift you can give your student, child, friend, partner. And finally, we need to be reminded that there are basic human needs that need to be attended to. Good habits of sleep, exercise, a healthy diet, human-to-human interaction, and creative endeavors. So I grant all the loved ones here and online the right to nag these students with great kindness as you see them consumed by their profession, and they will be. As you put on your white coat today, symbolically, you assume the mantle of a professional. I would also like us collectively in this room and online to offer the white coat as a cloak of love and support. We are overjoyed. I am overjoyed. Your faculty are overjoyed that you wonderful, diverse, kind, and talented students have agreed to become PAs. And you've chosen to do that here at Emory. And I want to thank everyone else who has joined us online or in the auditorium today. Thank you for being here and showing that you want to be a part of this. And finally, thank you, faculty, Maha, Bill, everyone, for allowing me to do this. It means so much to me to be part of this on this 50th anniversary of our PA program and on Dr. Stead's birthday. Congratulations.
And now for the white coat ceremony. The white coat is a symbol of trust. It is a symbol of your developing knowledge and skill. The white coat signifies the fiduciary responsibility that you will have to each and every patient whose life you will touch. Class of 2022, may you understand the gravity and the weight of this responsibility as you proceed through your training. And every time you put on your white coat, may you be reminded of the sacred trust your patients will be placing in your hands. When Dr. Lund calls your society name, please come forward as a group to the left side of the stage, the bottom of the ramp. From there, she will call you individually to come across the stage to be coded, and I believe photographed, to be coded by your society leaders.
We will start with the Peterson Society. Please line up. And the Peterson Society will be coded by Vikita Smith and Greg Burke. Benjamin Anderson. Megan Clack. Okay, you can go back. Countess Davis. Taylor Juretic. Danielle Mitchell. Hannah Palmer. Madeline Prisball. Ellie Seno. And Gabriel Yoon. Thank you, Peterson Society. Okay. Next, we have the Hearst Society. You can walk through the front, yeah, that's okay. And the Hearst Society will be coded by Karen Newell and Kathleen Hoff. She's hiding. Angela Andrews. Shannon Connolly. Hannah DeMeester. Bria Frainer. Mingxin Lin. Bernadette Wen. Julia Rich. Jamie Schatz. Yasmin Tenorio Chavarria. All right, could I have the M&M Society please line up? And the M&M Society will be coded by Bill Bryson and Kim Orlick. Sorry, I have you in alphabetical order. So I have Dana Bosinski, sorry. Casey Boss. Christina Cho. Avery Ellaway. Shanthi Joseph. Sorry, George, it is your turn now. Okay, George Hunt. All right. Morgan Swan. Isabel Cecilia Walker. And Julia Yu. Okay, next we have the Heimlich Society, please. And the Heimlich Society will be coded by Alan Platt and Sonia Green. All right. Katie Bauman. Catherine Crawford. Matthew Driscoll. Very smooth. Elaine Golden. Lily Ha. Like a pro. Cody Phillips. Colleen Weber. And Kathy Yadagari. Okay, could I please ask the Hudson Society to line up? And the Hudson Society will be coded by Jeremy Amayu and Lisa Ward. Blake Ballard. Shannon Duffy. Vinicki Fleming Harrell. Allie Cooper. Katie Luquire. Milena Prudhomme. Jay Visball. And Avina Villas. And the last but not least, the Stead Society.
Happy birthday!
And the Stead Society will be coded by Alex Kendall and Hope Davis. Cruzy Baker. Beverly DeCorso. Annie Thorne. Dania Lore. All right. Jacqueline Nunez. Gina Shipman. Arlen Tucker. And Cedar Wilkening. Congratulations to the class of 2022.
Yes. All right. Congratulations, class. Now, if all the students will please rise as we recite the PA professional oath together. Medical professionals in the audience and on stage, please feel free to join us. It is on the back of your program. in case you don't have it memorized. Okay. Are we ready? I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with a physician. I will share and expand knowledge within the profession. These duties are pledged with sincerity and upon my honor. Give yourselves a round of applause. That was pretty good. I just want to say from the podium, I've done the PA oath more than a few times, and you all nailed beneficence, non-maleficence, and justice. You nailed it. My stumble meter was real low on that. Well, we would like to thank everyone for coming out this afternoon. Thank you, Dr. Ely, especially for your words and guidance. We are looking forward to seeing you outside in, I believe, the courtyard of the School of Medicine under the tent. We'll have refreshments for everyone. So if I can ask the guests in the audience when we conclude to exit out the stage right door, that door back there. I need all the students to stay in the auditorium because we are doing photos after the ceremony, AKA now. So we're doing society photos, and we'll be calling you up society by society in this order. Hudson will be first. Congratulations. Heimlich second, followed by Stead, Hurst, Eminem, and Peterson. Natasha Randall, I don't know if she's in the room right now, but she is our photographer and daughter of Marquitha Mayfield. She is here to take photos. So before we conclude, I would like to thank the entire PA faculty, program, and staff for getting today's ceremony, making it happen. We want to thank everybody for joining in today, both in the auditorium and online. And we're looking forward to seeing you outside. Thanks for coming, everybody. Congratulations.